What causes anorexia nervosa? Have you ever wondered what leads someone to develop anorexia nervosa? This serious mental health condition is marked by an intense fear of gaining weight and a distorted body image. It often results in extreme food restriction and dangerous weight loss. Understanding the causes of anorexia nervosa is complex, as it stems from a mix of biological, psychological, and social factors. First, let's talk about biological factors. Research indicates that genetics play a significant role in the development of anorexia nervosa. Studies involving twins and families show that individuals with a close relative who has had an eating disorder are at a higher risk. This suggests certain genetic traits might make some people more vulnerable. Additionally, changes in brain chemistry, especially involving neurotransmitters that manage mood and appetite, are believed to contribute to this disorder. Next, we look at psychological factors. Certain personality traits are linked to a higher risk of developing anorexia nervosa. Traits such as perfectionism, a tendency toward negative emotions, and impulsivity can lead to rigid thinking patterns about food, weight, and body image. Low self-esteem and a strong desire for control are also common in those with this condition. Social and cultural influences play a significant role as well. In many cultures, there is a strong emphasis on thinness as an ideal of beauty. This is often reinforced by media, fashion, and social media. Young people, in particular, may feel pressured by these ideals, increasing their risk of developing an eating disorder. However, not everyone exposed to these pressures develops anorexia, indicating that other factors must also be at play. Environmental and developmental factors can also trigger anorexia nervosa. Stressful life events, trauma, or significant changes like puberty or moving can be catalysts for vulnerable individuals. Family dynamics, especially if there is a history of criticism about weight or appearance, can also influence the onset of this disorder. In summary, anorexia nervosa is caused by a blend of genetic predisposition, psychological traits, social and cultural pressures, and environmental triggers. Each person's experience is unique, and the interaction of these factors varies widely. Recognizing the complexity of anorexia nervosa is vital for effective prevention and treatment. Early intervention, supportive relationships, and access to professional mental health care are essential. Challenging unrealistic beauty standards and promoting a positive body image, especially among young people, is crucial. If you or someone you know is struggling with symptoms of anorexia nervosa, seeking help from a qualified healthcare provider is strongly recommended. Remember, anorexia nervosa is a serious condition with potentially life-threatening consequences, and treatment should always be guided by medical professionals.